Thank you. So since, just for the record, we don't have a quorum for the meeting yet, but we'll get started. We will skip the approval of the minutes until we have quorum. We'll go to the third item on the agenda, which is having Council Member Andrew Bagley come and talk to us about his thoughts and where we are and kind of progression, so that we have a little bit more guidance as to how to proceed, since we have, I believe, 4 or 5 meetings left. So thank you, Council Bagley, for coming here today and kind of just, I'm assuming that you've been listening to the meetings and would love some of your feedback on your thoughts as we kind of go through the process and eventually get to a place where we can make some recommendations to City Council.
Yeah, thank you, Will. And I have watched all the meetings, and I really appreciate the time and effort that's been put into this. I think it's been more productive than I could have hoped for. You guys have identified a lot of needs in the community that are going unmet, either due to COVID or previous to COVID, and perhaps some gaps. We have a lot of nonprofits in the community, but there's some gaps that no nonprofits seem to cover because it just falls outside of their mission, but it kind of prevents them from doing their mission. One of those seemed to be transportation, which I think you guys have realized is a very expensive issue. I did particularly like your idea about taxi vouchers. Not sure if that would qualify for COVID funds, but small efforts to improve the capability of people to get to meetings for mental health, doctor's appointments, childcare, I think are huge. One thing might be worth looking into. I know you had Coast come to a meeting. They do offer a shuttle service, so it may be worth the city reaching out to make sure they have the resources they need, and if they are at capacity, if there's anything we can do to help them with capacity. Another idea that I think one of the things you guys have helped identify is especially for kids, the lack of social interaction during the height of the pandemic has caused a lot of follow-on actions. As a father, I can attest, the kids, they're very resilient, but this is ongoing effects. And one suggestion that has been proposed in the past and kind of dovetails neatly with where you guys were talking about vans is there has been talk in the past about a library bookmobile. And the library has a ton of tremendous outreach programs. They have the little libraries around town. But I think it's sometimes an underutilized resource. And a lot of that has to do with, parents with young children. They just don't have a lot of time on their hands because that's just how it is. So they may not be aware of these resources, or they may not have the capability to get over to the library. If you bring a bookmobile to the different communities in Portsmouth, it raises that awareness. It almost creates like a neighborhood night out every time it happens. So parents that live adjacent to each other might get a chance to meet other parents. There might be carpool opportunities. So I think that might be something this group could identify. That's a real actionable item and would have a tremendous impact.
I love that idea. I'm sorry, did you say that the bookmobile already exists, or is that something that?
I think it's something that's been proposed but never funded.
Okay.
If the city manager wants to.
I'm looking at Kim because she's got more history than I do, but when we were first polling staff upon receipt of ARPA money, we asked all the department heads what would use ARPA funds for, and the library has 2 different bookmobile ideas in mind. One is a little more lavish than the other, but was the former library director and then the current library director, so that great minds think alike. They've been looking to consider a bookmobile, and it's just been a matter of funding and then how do you operationalize it. Does that sound right? Okay.
And then the final idea I have, which also may be difficult to complete, is, we have a lot of summer camps in the community. And I don't know that it's necessarily a funding problem in the sense that Most of the camps, I think, go to capacity. I know they did when my daughter was younger. So there's not really a lot of vacancies, but there are a lot of members of the community that just can't afford tuition to those camps. So, PMAC, Theater by the Seas, Papa. I know the city has the recreation department that we offer some sliding scales, I think. But Strawberry Bank, there may be things, especially in the summertime over the next 2 years, that we can do to get those kids out in the community and interacting with people. So those are 3 kind of ideas that I have. I don't know if they're feasible or not. I think they might be worth looking into. And I think ideas that have a similar kind of cross structure might be worth considering. But I think, whether or not we execute on any of these ideas, you guys spending the time to talk about all this has raised awareness and created connections that I think is invaluable. So I think it's safe to say that this has already been a huge success, and I hope we'll get some more out of it. But it's been more than I expected when we came up with this concept.
Ask a question?
Yes, please.
So, thank you. I like those ideas. I think one of the places where I keep getting caught up in is that this group has done a great job identifying, as you said, all of the needs that are out there. Where we've gotten caught up a little bit is what do we do around that, knowing that there's lots of organizations, some you just mentioned, that are addressing some of these needs. And ultimately, I know we're making not proposals, but we're making recommendations. But the decision-making process isn't really clear. I mean, it seems like, in my opinion, it feels like we've done all of the work that we can, because it's now up to the city to kind of bounce that around and come up with the ideas like you were talking about. We might be able to come up with a few ideas, but I guess I'm just kind of a little bit stuck in terms of what do we do from here? Because I know the original intent was ideas like you just said, which are the low dollar, higher impact ones. But the issues that we've come up with that people are struggling with are so big, and there's such little amount of money. And just trying to figure it out seems challenging.
I think another thing, and this is just coming to me now, thanks to your question, that this committee might be able to do, or the city might be able to do, is, and I've heard it said in the past, we don't really have a inventory or a master directory of all the nonprofits in town, which I imagine would be dynamic because it changes as some open and close. That could be something this committee proposes, is that there just be an email list or a distribution, so that when the city receives something from the New Hampshire Municipal Association saying there's a grant available, we just automatically fire it off to all the nonprofits. So that might be something this committee could recommend as well, which would be low cost, but I think high impact in the fact that it continues the open door communication between the different groups as well as the city. Because I think what will happen is, as time goes on, things will be proposed or things will arise that we can't anticipate at this moment. And a lot of the problems I'm seeing is we don't necessarily, and by we I don't mean the city, I just mean, say the federal government or the state government has a grant, but it's not a municipal grant, so it doesn't really come to the city. It should go to, say, Crossroads House or to Haven, but it doesn't get there for, communication reasons. So the city might be able to take a little bit stronger role, and I don't know what the city's current role is. Maybe that's something we're already doing, but that might be another way to address those types of things.
We did come up with a concrete piece around the Community Resource Network.
I was just going to say, Andrew, we discovered, so this is the Community Resource Network, and it's exactly what you're saying. It's all the nonprofits. It's just not extremely user-friendly because it's like a PDF you download. So we were even saying at one point, if there was money to fund some web development to make it user-friendly so that you could go in and search as a community member or something like that, so that it's not just a PDF that's being downloaded. Because it exists, it's just not very user-friendly.
Yeah, so that would be a good, in my opinion, proposal to bring
Yep.
to the council, because
Yep.
it's a finite thing, it's a discrete
Yep.
amount of money, it's not a huge amount probably.
Yep.
I don't know, that's not my background.
Right.
But it seems like something that, we could use,
Mm-hmm.
and, would be a good use for some of the COVID monies.
Okay. I think the thing is, like you're saying too, is those proposal pieces. Like, I guess that's where we have a lot of ideas, and we did the slideshow with some of our ideas. So we have them. So now, what do we do with them in terms of the city council? And I guess that's the part that we're kind of struggling with, because we're like, okay, even the ideas you said, awesome, scholarships for a summer camp, the bookmobile. So then, what happened? Like, what happens next, I guess? How does that happen?
So
Maybe
I-
we don't know. I don't know.
I think what could be good is you had the slideshow with
Yep.
the issues.
Yep.
Come up with 5 to 10 actionable items.
Yep.
And then work with city staff to see which are the most feasible. Because the council's going to, well, I can't predict how the council will vote, but as a counselor, it's much easier to vote for or against something
Yep,
than
okay.
it is to kind of come up with a solution on the fly. So
Yep.
I think if there were some,
Yep.
you know, maybe you don't need the details about a bookmobile, but we think the council should
Right.
at least look into this idea. And we
Right.
think the council should look into this idea, or.
Yep, under those kind of main headings like transportation, tax
Right.
vouchers, I don't know, what,
And then
mental health, summer camp option, scholarships or something like that.
And then what
Big
the-
headings, okay?
Council could do is look at those ideas and take maybe the top 5 or whatever,
Yep.
and refer them to city staff for report back.
Right.
And then the city
Yeah.
can report back to the council which each item is anticipated to cost.
Yep.
Looking to the city manager, does that make a?
I think that's a great idea, and
Yeah, I
that
do too.
could help guide the staff on what are the important policy directive or priorities that you, as a group, see from the work of this task force.
So, as it relates to process, because you mentioned it, would it be better for us to come up with a set of recommendations, work with the city administration to say, okay, these are the things that we want to recommend to city council. What do you, as a city, what do you think is doable? And then at that point, it goes to the council. Council then, at that point, because the city's backing it, these are the things that we think we can back. Is that, to your point about the council voting on something that's, one, been vetted by us, also vetted by city administration, it's easy for you to get on board?
Yeah, so I think the best way to do it is for you guys to make the suggestions, the council to refer either all the suggestions or some of the suggestions to city staff for report back, so that they can come back with, the financials, how much they think things will cost, what the timeline might be, the logistical side. So you guys would present the idea side. The council would either accept or deny the ideas, and then report those ideas to city staff for a report back. The city then would report back to the council, I would imagine, saying, this is what each idea costs. These are the ideas that, staff thinks are easiest or hardest to implement, and then the council would vote. I'm just kind of spitballing here. I don't know if that's
Yeah.
the proper way to do it, but that's kind of how I would envision it. Because you guys are kind of the view from 30,000 feet, and then the staff would be the technical details.
If I can add to that, I think,
Yes.
I think what would be important, that any recommendations for the expenditure and obligation of ARPA funds requires a public hearing. So to go through the steps that Councilor Bagley mentioned would be good, because then we could distinguish through the notice process what are the items that would be coming to council for consideration of expenditure of ARPA funds.
Okay.
Can I just ask one question about this, which is just in terms of the process? So you're saying send it out to or give it to the city staff to follow up on the cost on different items, right? And then would we want it to come back to this group to think about prioritizing based on the costs, what our recommendations were? Because, it's kind of it could be, $50,000, it could be $250,000, and would that make a difference in terms of what we would recommend moving forward with?
I think it would, once you make the recommendations to council, it becomes a political decision where to spend the money.
Okay.
So council would have to make that decision. Now, that doesn't mean that the council might decide that we want to get more insight, but I do think that once you guys make the list of recommendations, it kind of, that's when it sets sail, so to speak.
Right. I was just curious if we try to do anything around ballparking, like cost of different things, to get a sense of what we really could recommend. Or
I would shy away from that because it's pretty difficult to ballpark. I've learned a lot of things. You think something costs, say, $25,000, and then you learn that, just the study costs $25,000. So ballparking can be challenging.
Yeah. Can I go back to you were talking about kids and the social interaction and library, summer camp. A lot of that sounds like on the younger side. Are there any activities that would be recommended that would be just as effective for teenagers or older?
Yeah, I'm glad you brought that up, actually. I kind of tend to focus towards kids, but the bookmobile could also go to some of the senior communities in the community, and the rec department and the senior center, could also potentially offer, scholarships. Say, like we do meals at the senior center sometimes and at community campus, and maybe for the next 2 years we have 50 vouchers for those meals or something along those lines. What we want to try and do, or at least my intent, is to reach those the most at need. And I think those most at need oftentimes are the hardest to reach because they've got so much. When you're going through a crisis or you're having a lot of challenges, it's difficult to know where to go to help sometimes. So you can get overlooked. So I think proactive into the community type things, because then by word of mouth, people will start to learn that, there's a dinner I'm going to, or the bookmobile is coming, or something that's happening that, kind of spreads organically, helps reach, all the different age groups.
Well, and I think if we're thinking about that idea too of scholarships or funding, like if I'm sure through the rec department too, I mean, sometimes it is an issue of funding, but looking at teens, that might be something that could be, could it be funded to have, some programming similar to like New Heights that existed that's gone, but like taking kids rock climbing, teen programs, which we don't have a lot of right now. But that might be a new initiative that if they had funding, they could do, and say like that they're taking them on a 3-day camping trip or just different things that we haven't thought of yet, but with funding, maybe they're able to do to reach that teen population. Something like, I don't know, we could think about that.
And then, I have another question, and I know the task force has discussed some bigger picture stuff like housing and workforce. What do you have any thoughts around any of that?
I've got a lot of thoughts on that.
Housing and work.
And then childcare, I would add to that as well. I think those are huge needs in the community, but they're too complex to solve with low-cost, high-impact solutions.
Yeah.
To kind of put it bluntly, I think. But yeah, those are big challenges, and they are not simple challenges.
No.
And they're not going to get solved by $3 million or $5 million. So, any other questions for Councilor Bagley? I think your input has been really helpful.
Yes.
Thank you very much. Any other thoughts before?
Did you have a question?
Yeah, I was just going to say, what you were talking about is pretty much all the response I would get from all the people I would ask and talk about these issues in the community. There's so many problems, and what comes up often is housing and workforce, which we just sort of dismissed. That people that are working here in all of our little businesses and stuff cannot afford to live here anymore. And that is an issue. I know this money's not going to be able to go out to them, but that is a major issue for our city. I'd say about 6 out of 10 people say that to me every time I speak with them.
Yeah, I mean, I get emails and phone calls all the time about people whose families can't stay in here, or they have somebody who's come back from college, or their folks are older. I guess what I said inelegantly is we're trying to address that through zoning changes, through ADUs, through affordable housing projects. So the council is very concerned and working on these issues. I just don't know that. I don't think the ARPA funding is really an effective way to solve those problems because they're such big long-term frame problems. So I didn't want to dismiss the problems and say they're not issues. I just don't think that we can address them through this community.
And just to offer this to you as a student council, a council member, people suggested that perhaps there might even be a forum at the library, because we used to have public forums about issues in our city, and a public forum about those issues, and have people open up and talk about it and hear what are possibilities. instead of just, speaking with the neighbors and, I mean, it would be an interesting public forum to have at the library or something.
Yeah, I mean, we could have more forums. We did have one about a year ago at the South Church. We had one at the music hall. Of course, we just had the meeting at the Lister School. That wasn't really so much a forum, but I think there's going to be a lot more talk and a lot more addressing of this issue. 10 years ago, affordable housing wasn't really looked at as a crisis, except by maybe people that could see where we were headed. I think today, everybody has a relative or a friend that can't afford to stay in the city, and that's not unique to Portsmouth or New Hampshire. It's across the United States. So I think affordable housing has become an issue that is acknowledged by almost everyone. So, but there's no simple solution. So I think those are great ideas, and we'll be doing more of that. But yeah, it's a tough one.
Yeah. Thank you, Councilor Bagley, for coming, sitting with us for a few minutes.
Yeah,
really appreciate
and thank
it.
you guys for all the work you've been doing. It's been great to see.
Yep. So I want to just take a few seconds to approve the minutes of 1/17/23. So given that we have a quorum now, I'll entertain a motion for approval of minutes.
A motion?
Kathy made the motion. I need a second.
Second.
Okay, Abby, thank you. All those in favor of approving the minutes of 1/17/23, say aye.
Aye.
Any nays? Any abstentions? Thank you very much.
Chairman, could we take a moment to welcome our new member?
Oh, yes, of course.
Thank you.
Ann Hayes. We're so happy that you're a member now.
It may be very brief, but.
That's okay. And actually, that was very quick, so thank you, Karen.
Sure, you're welcome.
Okay, we're going to have a presentation from Kim McNamara.
So this is all right?
Yeah, of course.
Okay.
Kim,
Well,
will I be able to say, see attached presentation, or should I take minutes on that?
it's, probably you can just say see attached.
Okay.
yeah,
This
thanks.
is all in
Sit
draft
back
form.
and
because
enjoy it.
we're still working. So this is part and parcel of our community needs assessment and community health profile. So I just want to give you some examples of what the reports are going to look like. And I'd like to speak a little bit about seniors, which we've had some stakeholder meetings already and focus group attempts with this population. But this is also to introduce you into the reports, mostly in draft form because there's a short timeline here that you will be seeing over the next few weeks as we really are getting a lot of data in, and we're having a lot of these meetings to pull together information for how COVID has affected our vulnerable populations and potential solutions to that. The one thing I wanted to ask based on the conversation that just occurred is, could the health department have a copy of all of your proposals or your ideas? Because what I heard discussed around this table is very much at the heart of some of the equity issues that we're looking at and ways to overcome that, which is really what ARPA funds for the public health side were intended to address established inequities that are inherent in a community and start to overcome them. So I was very glad to hear that conversation, and if we could get a copy of that, that might show up in our needs assessment, if that's okay process-wise, Karen. All right, so these are just a few of the many slides that we have for the demographics that came back. The full report will go to the city council and city manager when it's done, but just to start off, you will see basic demographic information presented like this. Portsmouth is a little bit higher percentage of females than males, which is a little bit different than the rest of the state, and interesting, but next slide, please. For the age distributions in Portsmouth, we have both of these graphs show the same information. It's just easier for people to grasp different levels of it. But you can see our ages less than 5 are around 4%, ages 5 to 19, 13%, ages 20 to 34, 24%, 35 to 54, 27%. 55 to 64 is 13%, and then our ages 65 plus is 19%. And this is Portsmouth-specific numbers. Next slide, please. So part of the reports that you will see are these little introductory paragraphs. These are just statements of what we're finding so far. They're very undeveloped, but I wanted to give you a sense of where these reports start from. So with childcare, parents can't go back to work without safe, consistent childcare. Daycares are suffering from a constant lack of adequate staff to operate within the required and safe staff-to-child ratios. And loss of a single staff person can close a classroom for a day or for a week or for an extended period of time. So recovery from COVID requires paying enough to attract and retain adequate and qualified staff, including providing benefits to those staff so that workforce can remain healthy. Support services for persons with intellectual and developmental disabilities. You'll be hearing more on this. But supervision and support is often required around the clock without a direct care workforce, which we are lacking and have been for a long time. Many persons with intellectual and developmental disabilities have been isolated and languishing since 2020, unable to have the support to even do simple activities. Because of this lack of support staff, and many have a higher risk factor for contracting COVID and the outcomes of that, so they are a particularly hard-hit group of our vulnerable populations. Families who must now provide all of the care and the supervision and be the sole advocates at this time to protect services and quality to their family members are exhausted and under emotional and financial strain from this. Recovery requires financial assistance to open supervised residential programs in secure housing, provide inclusionary supports in local recreation and arts and cultural opportunities, local employment and social opportunities, and local championing of legislative changes on a state level to protect that population. Not even going to talk about affordable housing, but it's important to know that the inclusion of this group is so vital in city planning. They should be considered whenever we're talking about any of these issues: transportation, housing.
Kim, can I ask a question about that? What are we talking about? Do you have any sense of numbers of this population in the city?
I have a sense, but I'm verifying, so next week, or next time I bring to you, I'll have that information. But we do know that the rough estimate of persons with overall disabilities in the city is about 10%. But we're drilling down into that data as we speak.
I would say Lori McIntosh would probably be the resident expert on that. Yeah. So maybe we can get her to weigh in at the next meeting.
We'll talk about substance use disorders in the upcoming weeks. So I'm going to go right to isolated seniors because this is what I've drafted for you today. So COVID has left many seniors without the necessary personal care and in-home support services. Continued concerns over circulating virus also causes the isolation to continue, and particularly those with mobility or resource constraints. Recovery requires an expansion of the home health care workforce, accessibility repairs to aging homes, and a system of well checks, as well as this is exactly what Councilor Bagley was talking about when he said that it's very difficult to reach those most in need. These are folks that cannot get to senior services, they can't get to the senior center, some can't get to their doctor's appointments, so on and so forth. So somehow finding ways to include them in all the healthy things that we do for the general senior population is going to be very important. Next slide, please. This is what our experience has been, and we also sit on the community care team, which this resource guide is a product of. There's many people there that interact with seniors, and this is what we have found so far. Exacerbated by COVID-19, there are more seniors being found in high-risk situations, too often with poor outcomes, that we didn't see pre-COVID. These seniors often have higher and more complicated needs than pre-COVID, as their supports, resources, and services continue to be diminished through COVID recovery. Next slide, please. So here are some examples of recent situations that have been encountered in the city. We found persons living in insanitary conditions that are not discovered or reported until they are discovered by emergency services, so things have to get pretty poor before that occurs. and then they're reported to the Health Department or the State Bureau of Elderly and Adult Services. We have disabled adults and seniors that are living with and cared for by other disabled or medically frail persons. This includes persons with advanced dementia and multiple debilitating or end-stage diseases. We have seniors that are not able to complete applications for Medicare or long-term care, not that they're simple applications, but reasons include things like the regulations. You can't apply to long-term care in both New Hampshire and Massachusetts at the same time. And then there's just overwhelming living situations that make it hard for people to focus on that. We have persons in frail situations leading to hospitalization, being discharged into those same unsafe conditions. We have seniors who live in their family homes becoming disabled with age or injury, and those homes are no longer safe for their needs, but their needs are a little more than what we can find grant funding for to do repairs. And we have misplaced seniors in Portsmouth. We find elderly or highly disabled persons suffering from dementia and mental illness and other handicaps. We find them in our homeless shelters or in public housing without the necessary assistance or supervision. Next, please. The effects of this on the community are low quality of life and unsafe living situations, leading to increased morbidity and mortality for some Portsmouth residents, increased costs for emergency services, increased costs of avoidable hospitalizations and surgeries, potential increased costs for city welfare, and increased city departments' time spent on case management type services that were traditionally handled by outside agencies, by nonprofits. Next, please. And then we do have possible contributing factors. It includes things like just that loss of interaction with the larger community, the loss of local case management services, some limitations to state reporting and response. We have shortage of Medicare beds in long-term care facilities, and really lack of planning for the aging, intellectual and developmentally disabled populations. So these are some of the contributing factors. I'm sure there's many more. Next, please. Potential solutions. Restore the local broad case management services. Well checks completed on all residents.
Can I ask a question about that? When you say restore local broad-based case management services, what does that mean?
Well, we did used to have the IDN network that did broad case management services. They were looking for funding. Unfortunately, the funding didn't come through. The first year, Tori Jennison cobbed together funding, but then it was lost during COVID. And so they no longer exist. Now, some of those people were hired by another local nonprofit that does a lot of public health work, but the intake is different. Their focus is much more mental health rather than these broad senior needs. So we've lost that.
Okay, thank you.
Sure. As far as well checks, it takes staff to do that. We did just ask Portsmouth Housing Authority to do this because we were running into some of these issues in their facilities, and they did a great job going in just to checking to make sure people are okay. But of course, that took time, staff time. We need things like a system of guardianship appointment that's responsive and easy to navigate. This is one of those things I talk about when I said in past meetings that sometimes the things that we need is legislative support. It's not funding. It's just, we have a very active legislative committee, and maybe we could bring some of these issues to them. And then long-term care facilities should be included in community development planning, and supportive housing for seniors with intellectual and developmental disabilities should also be included in community development planning. I don't know if that means master plan. I'm not that well versed, but so these are all the vulnerable populations that we are looking at from a data perspective and also from a needs assessment perspective. And these are conversations we've started having and writing up these needs assessments, and will be having hopefully in the future. And I understand, Will, by your timeline, we'd love to have this done by the end of April. And then there was a question that...
Could we just go over those? Just give us a minute to just kind of look at that, going by so
I'm sorry?
quickly. I'm just absorbing
Yeah.
how much stuff, even though we've spoken a lot about this stuff, it's incredible that you're listing all the stuff that is absolutely critical here.
These are just the vulnerable populations
Yes.
that we've already identified. There are more that are coming through when the data comes through. But this also points to the need that this might want to be a long-term, ongoing type of assessment, you know, that can be done low level every year or every couple of years. Thank you. And then the question keeps coming up, and I watched the last meeting, so I just want to be really clear about, this was just a tally of a sampling of the community nonprofits that I reached out to and just asked about their needs when we first started learning about the ARPA funds. So the health department requested the $63,000, and it was granted for this needs assessment and community health profile that's going on now. In addition, we asked for $3 million to be set aside for the outcome of this needs assessment. So all these vulnerable groups, when we finally identify these needs, there will be money to address those needs. That is in addition to these requests that came in. I took the names off of the agencies that requested these because these came in a year ago, so their needs may have changed, and I didn't want to just put that out there. But this has a great overview of just a sampling of the needs we saw. So we had multiple applications for recovery services being identified as a good use for ARPA funds to the tune of $1.4 million. The intellectual and developmental disability supportive housing and programming at that time was looking for $10,000. Health and dental care and family support services for special populations, $500,000. So you can go through this, but what I really want to point out is that there's a broad range of nonprofits in this sampling. One of the things that's repeatedly mentioned is the summer camp idea. You know, a great way to build equity, whether it's for minority populations or low-income populations or disabled populations. The IDN Region Network there, they did request funding, but they have since gone away. And so the other thing I want to point out is there is such a need, as we've all been talking about, and so little money. So that's $2.9 million in requests that came in that are separate from what the health department is asking for. So I just want to clarify that because that question keeps coming up.
Can I ask a question about what you're asking for? So you're saying the health department wants $3 million to address some of the needs that come out of the assessment?
I want to make, the health department would like to make sure that once we identify these needs, that there's some money left to address those needs, as is one of the main functions of the ARPA funding, as stated by the federal government when they put it out. So, but the $3 million is not for the health department to address the needs. The $3 million is to go to the nonprofits and others who address these needs because they're doing a fantastic job. Let's just keep them in existence is the thinking.
So what would be, like, I understand recommendations and the city's council's part of decision-making. What would be the decision-making around the funding that you're asking for?
It's all city council's decision-making.
It's still city council's
Yep.
decision? Okay,
It's just a request, a dream.
got it. Thank you.
Okay, other questions of Kim? Kim, is that the end?
Yes.
Questions?
Kim, the ones that say TBD, that's not obviously included in the almost 3 million from
Right.
nonprofits.
This is for illustration purposes. This is to show you the need that's been in existence for at least the last year that we've known about. To be determined, we didn't receive any requests, even though there were multiple things listed. You know, we would like this, 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 and this can help, but there wasn't any financial amount, right? And some of this has changed. There was a way where PMAC was able to work with the school system, and through ESSER funds, they were able to get the music camps up and running in time. So, so this list isn't solid in and of itself. It's to answer that question that keeps coming up. Yeah.
Thank you.
Well, and it is important to see that it's a sampling because, as Kim said, not all nonprofits were included in that.
I have just a question about the kinds of things that you're seeing that are so tied into workforce and then obviously from workforce to housing. So a lot of the things related to, for example, addressing the needs of the elderly or people with disabilities is going to require workforce that we currently don't have. So I guess maybe this is a question for Karen in terms of a broader plan. Is there a plan that's being developed that is beginning to address the issues around workforce? Because obviously we just don't have the workforce to address these needs. So so we can, we can make recommendations for funding, but if the workforce is not there, then it's a moot point.
Right, and that's where we would bring in my colleague and Kim's colleague, Sean Clancy, to work on that piece of the puzzle. But you're right. It's, we could come up with summer camp scholarships. We could put money to all the groups that organize summer camps, including the city, but we can't find bodies to hire. And we would hate to promise something that we couldn't deliver, and I'm sure other organizations are in the same boat.
Same with the childcare piece of things.
Exactly.
You could recommend more staffing for childcare places, but they can't get them.
If I may respond also. So during our conversation recently with the Seacoast Mental Health Center and also with the recovery community, it's been pointed out that there are some very able-bodied persons looking for employment, and that's a large part of their recovery plan or their health plan. And so how do we connect employers that need employees with these employees that need employment? And I did have a brief conversation after that discussion with Sean Clancy, our Economic Development Director. And so those are means of addressing this issue that don't take into account, you don't have to deal with the entire workforce issue, but there might be hidden workforces capable of doing jobs that are not considered. And I would include the intellectually and developmentally disabled people in that. And so I think we need to look at those people as a resource that we might be able to use to address this issue. One of the important things about this needs assessment that we're doing is we're looking at it on a level of what can a municipality do, not, how can we solve all the world's problems. So we are going to be focusing on the things that can be done on a community level. And a lot of that might not be, we can't solve the workforce issue, we can't solve the housing issue, but we can be sure that in city planning, persons with all these vulnerable populations are all included when you're planning for that.
Mm-hmm. Thank you very much. Any other final questions for Kim before we move on to general discussion? Thank you, Kim. That's
Thank
been
you.
very helpful.
Thanks, Kim.
So I'd now open it up to general committee discussion around some of the things that we heard today or any thoughts from prior meetings.
Well, one of the things that I was thinking about as both guests were speaking is thinking about what the different nonprofits are doing right now on that small scale to address some of these issues. I know we're looking at, are we purchasing our own vehicle to address some of the transportation stuff? And that might be an interesting conversation to have with so many of us at the table about, what are we doing around the child care piece of things or nothing. To just come up and see if there's any like-minded things that groups are doing that would be the smaller fixes to larger problems.
You know what, it's, my grandson goes to the daycare center on Pease, and I know that we have had him many times because of COVID shut his classroom down. Last week it was a water issue at the school, closed his classroom. So for people like me who comes into one of the other senior categories, I mean, I don't know what my kids would do if they didn't have us around. But I'm wondering this out loud, I don't know anything about it. I wonder if some other people that go to the senior center, because I know I live right near there are people there all the time. If there's any way to work with the seniors that go there predictably, that are in okay shape, wouldn't it be nice to have them be able to subsidize childcare in an emergency kind of situation? Right. They might like snuggling up with some of these kiddos. It might serve a need for everybody. I mean, don't think for a second I don't love having my grandson around, but don't think I'm not tired when he leaves. So I wonder if there's any way we can dovetail some of that thinking and solve a couple of problems. Because there's a lot of people that go to the senior center who just go there because they're lonely. You know, they might like to, I don't know, I don't even know if it's feasible. But
Kim, there's an idea for you.
thank you.
We do play groups at a variety of locations. We could certainly expand at that, and we have play groups on site at our Portsmouth location. So, and you don't have to be patients to join the groups.
What do you do around transportation?
We don't. Typically, like we're in Idlehurst and Somersworth, and it's the kids are there, or the parents are driving or walking there, because it's the parents and the kids, and they really appreciated that just after COVID, the peak, because they had been isolated with their kids.
So I think to Kim's idea that there are these populations that we tip in years past we have not included in our workforce. And they may have limited capability, but nonetheless, they have some capability. And whether it's an elderly population that gets paired up with young kids, or I know that there are many companies that are hiring people with intellectual disabilities, and that's so there is something there. I think that probably needs to be paired up with the transportation issue, so that it makes it easier to get people around to where they need to be. So maybe, I don't know, Karen, how much the city is looking at that, but I think that there's something in there to some capacity.
I think you get into things like background checks and provisions or requirements that we might have that I would imagine similar organizations may or may not have to varying degrees. So just something to put out there.
Yeah, we because we're a recovery-friendly workplace, we do get a lot of background checks.
Yep.
That we have. We've really loosened a lot of our reins for that very reason. So, you know, if somebody lost their license or then we still take those people into employment.
So Job Launch is a workforce program that Safe Harbor runs. And, you know, taking into consideration that 10% of the Portsmouth population is disabled, and I'm not sure if that even includes the other eligible disabled individuals, which are those people in recovery from substance use disorder. So we have, along with individuals with developmental disabilities, we have all these employment opportunities that just need a little support from the existing nonprofits. And I think, you know, we need the health department to help structure these requests with the city council. Because it looks like there's a process already in place of some sort. No? Okay. So, yeah, that's all.
I mean, I think that's, to me, that's the challenge that exists, is that some of these great ideas are not just quick fixes that we can ask the city to fund. They're complicated. I was thinking transportation. I'm like, oh, maybe the city can buy a bunch of vehicles that we're trying to buy to help with the transportation piece. But it's hard to think of the things that wouldn't involve all the HR components of implementation. Yeah.
Just following up on what Linda was talking about with matching up seniors with younger kids, I haven't been to like the Portsmouth Senior Center, so I haven't seen what it looks like, but I know years ago when I worked with our church to do a young moms group, and they could bring their kids there, and we had, you know, kind of classrooms set up, and seniors, mostly seniors, were the ones who were helping with the child care. And I think, you know, I'm sure any number of the nonprofits here have done and could do background checks for people if need be. We do them all the time for staff and volunteers, so it's not a hard thing to do. But if you could get the funding to set up a room and stuff, or couple of rooms where people could do that. And also more helpful for seniors if they're not one-on-one, or, like, it helps to have a group of people dealing with a group of young, so that you could, because we've had staff members, we have, a single dad on staff, and with all of the viruses and things like that going around, boy, if your kid can't be in school either because, if they're bringing home all these things and you can't go to work because you're sick and they can't go to school because they're sick, and it just really builds into a perfect storm of problems. So if there's opportunities to do that, I think, obviously you don't want to have sick kids in with seniors, but there may be something that could be done. And on the transportation side, I work at Gather, and we did have a senior Valentine's Day dinner last night, and like Kelly Lesko from Portsmouth Housing did bring a group of seniors there with their transportation, and another person brought a group from where they were from a housing complex. So it's a nice way to get some of that isolation. It was a really nice opportunity. But using some of the transportation that exists, or maybe, to your point, could we get more of that transportation? Because once you can bring people together, that helps with that social isolation on a more regular basis.
Is what we're dealing with actually a lack of coordination? What would happen if we put the funding towards one hiree that had a budget and then was vested with coordinating all of this? I mean, is that something that's possible?
I think the question is who would house that person, and what happens when the COVID money has to be expended by 26? So do you set it up to be an expiring kind of situation?
I would assume yes.
Find other funding by the time it
Maybe,
expires.
yeah.
Right. Maybe that's part of the job of sustainability and social services coordinator, and they attend the community resource network, and they, their job would be to make sure all the moving parts are integrated. Because it seems like that's where we're falling short, along with the power and capacity to spend the money making this happen. So, I mean, that's where I think we'd get the most bang for our buck as a committee, but I don't know. That's all I got.
I was just going to, I'm remembering years ago, I've been a teacher forever, but during the summer I would do some other things, and a couple of years I don't know who I worked for. I was trained by, but I worked with seniors. I would be sent to seniors' homes, and I would visit them maybe twice a week and spend time with them and go over lots of things. And my background's in health and wellness, so I could connect with how they were doing. And so I did that. Like, I remember doing that for a whole summer. And then when school started, I actually had one of the seniors that I visited, who was like in his mid-90s, who had just incredible life history. I invited him to one of the classes to speak to the students about who he was and how he sold newspapers in New York City at 7 cents a paper when he was a child. I mean, and that just so lifted that person's spirit to even connect him, to get him out of his house. And I also, I don't think it was the same program, but I also worked another summer with troubled teenagers. And I'm talking about a long time ago, but, oh, God, I mean, some of those kids were in such bad shape. It was incredible. But by the time, like, the end of those summer months ended, I was connected with those children, and I stayed with one young girl. I could tell you an amazing story, write a book about her. Stayed connected with her. And she passed away after a while. And her mom still calls and says how important that work was for those couple of years.
Which are two great examples of some of the ideas that we're talking about.
Yeah, I mean, and I'm thinking, probably was minimum wage that I got during that summer, but but the connection with those people was amazing.
Yeah.
Kathy and Will,
In need they are today.
Kim scooted back up to the table because she said she has something.
Thank you.
Sue, thank you.
I just wanted to clarify one thing. When I was talking about the workforce, I wasn't necessarily talking about the representation from what's at this table. I was talking about the broader community. With my restaurant hat on, I know our restaurants are struggling tremendously. They had to cut hours. They can't do specials. They don't have the folks to help them. I know that some of the success stories are people in recovery going to work in restaurants. And so when I'm talking about the workforce, it's the broader community. How do we connect with them for that? So I just wanted to make that clear. And I wasn't saying the health department doesn't want to help. I was just saying we don't have a process.
Yeah, yeah.
Thank you.
And it's not something you're looking to, you can't, there is no agency in order to structure a process and accept proposals for funding, is that correct?
Well, it's a very large ask, or a broad ask, I should say. One person could do it if they were dedicated to that, but we are very busy, and I don't know for that sort of community planning that the health department is the best option. The health department is a good option for speaking up for vulnerable populations and the overall broad picture. But I'll leave that up to the city manager to discuss.
It's too bad that the IDN does not exist anymore, because would that have been the ideal place to suggest that this role lives?
Well, the IDN is a lot of case
Integrated
management.
Delivery Network?
Yes, for individuals. So if we were working on a difficult case and the person didn't have insurance and the hospital was discharging them, they didn't have a safe place to go, we would call the IDN and they would do all that case management, and they help with things like if you have lost your naturalization papers, they can get that. They can sign you up for usually focused on an individual. But I don't see why that couldn't translate into a community type of coordinator or planner for some nonprofit to want to house.
We used to have an organization, Kathy, what was her last name? It was down in Northampton. It used to be a care coordination. It was an organization that went away.
For healthcare?
Yeah.
Yeah, what was that called?
And support services. They were tucked away
Can't
in
think of it.
Exeter. I can't remember.
They actually had an office in here, too.
Oh, did they?
Yeah, at one point.
Well, we know the IDNs are sorely missed, and I to this day I just don't know why they went away, because they were performing something really valuable in the community across the state, really.
They ran out of money.
Well, I understand they ran out of money, but that was something that somebody should have done something about. Okay, so I think we need to close the meeting. Just to briefly discuss what happened on today. So we had Councilor Andrew Bagley come and visit, and I think some of the thoughts that he had as it relates to some of these potential programs for transportation kids and so forth seem to make sense and seem to fall in line with some of the things that we've discussed. Those are the low-hanging fruit, so I think that that's what we need to continue to focus on, because I don't think, and I think we're all in agreement, we're not going to solve, unfortunately, the housing or the workforce issues that have been going on for a long time and are going to continue to go on for some time. So I'll leave it there. Are there any final thoughts? I think we just need to continue along to think along the lines of some of these low-hanging fruit that Council Bagley brought to the table today, and of course thinking about also about what Kim brought to the table.
Yep.
I would just remind people, I know I can't make the next meeting, so if you can let Jessica know if you cannot attend, so that we make sure we have a quorum.
Let me share the meeting cadence with everyone. We meet every other Tuesday at noon, so the next meeting would be Feb 28 at noon, followed by March 14th, March 28th, and then we have one final wrap-up April 18th.
Right, thank you. So at this point, I'd like to, is there anybody for public comment?
There is not.
Okay. I'd like to entertain a motion to adjourn. Okay, moved by Ann. Second?
Second.
Last one is.
Kathy seconds. All in favor?
Aye.
Thank you.